Hello! Let's talk about something many people have but don't like to discuss: hemorrhoids. You might have heard them called piles. They are very common, so you are not alone if you have them. Think of them as swollen cushions, a bit like tiny varicose veins, but they are inside and around your bottom, or anus. These cushions of blood vessels are a normal part of our bodies, and they help us control when we go to the loo. But sometimes they can become swollen and irritated, which can cause discomfort and other problems. So, what causes these little cushions to swell up? It can happen for many different reasons. Often it's from straining too much when you are on the toilet, which puts pressure on the veins. This might happen if you are constipated and your poo is hard. It can also happen during pregnancy because of the extra pressure in that area. Sometimes, getting older or even lifting heavy things regularly can make you more likely to get them. The important thing to know is that they are not usually dangerous, but they can be a real bother, causing itching, soreness, and sometimes a bit of bleeding. When hemorrhoids become troublesome, they can make life uncomfortable. You might notice a bit of bright red blood on the toilet paper after you wipe. You might also feel an itchiness or soreness around your bottom. Sometimes you might feel a lump or swelling in that area. These symptoms can be worrying, but usually they are just signs that your hemorrhoids are inflamed. It's always a good idea to chat with the doctor to make sure it is hemorrhoids and not something else. A doctor can help you understand what is going on and find the best way to make you feel better. There are different types of hemorrhoids, and knowing which type you have helps your doctor decide on the best treatment. Internal hemorrhoids are inside your rectum, so you can't usually see or feel them. They don't often hurt because there are not many pain-sensing nerves there. External hemorrhoids are under the skin around your anus, where there are more nerves, so they can be quite sore and itchy. Sometimes an internal hemorrhoid can get bigger and poke out. Understanding these little details helps us find a solution that works just for you, which is what we will explore next. Now let's look at a clever way to treat hemorrhoids called the Rafaelo Procedure. This is a special treatment that helps to shrink them without needing a big operation. The name sounds a bit fancy, but the idea behind it is quite simple and very smart. It uses a type of energy called radiofrequency energy. This is the same kind of safe energy used in many other medical treatments. The goal is to gently treat the hemorrhoid from the inside, causing it to shrink down and go away over time. It's a modern and less invasive option for people who are struggling with this problem. So, how does it actually work? First, your doctor will use a small device called a proctoscope to get a clear view of the hemorrhoid that needs treating. Then, a very thin, special needle probe is gently inserted into the base of the hemorrhoid. This probe sends out the radiofrequency energy, which creates a very controlled amount of heat. This gentle heat works to seal off the tiny blood vessels that are feeding the hemorrhoid. By cutting off its blood supply, the hemorrhoid can no longer stay swollen, and it will start to shrink. It's a bit like turning off the water to a plant you don't want to grow anymore. The whole process is very precise and targeted. The doctor can control exactly where the heat goes, so it only treats the hemorrhoid and doesn't affect the healthy tissue around it. This is one of the big reasons why the procedure is so gentle on your body. The treatment for each hemorrhoid only takes a few minutes to complete. If you have more than one hemorrhoid that needs treatment, the doctor can treat them all during the same visit. It's a quick and efficient process designed to solve the problem with minimal fuss and disruption to your day. The magic of the Rafaelo procedure is that it helps your body heal itself. Once the blood supply is sealed off, the hemorrhoid will gradually get smaller and smaller over the next week or two. The symptoms you were feeling, like itching, pain, or bleeding, will also start to disappear as the hemorrhoid shrinks. It's a permanent fix for that particular hemorrhoid because it's no longer connected to the blood vessels that made it swell up in the first place. This clever use of technology offers a long-term solution without the need for more complicated surgery. One of the best things about the Rafaelo procedure is that it is much more comfortable for patients than old-fashioned surgery. A big reason for this is the type of anesthetic used. You don't need to be put to sleep with a general anesthetic. Instead, the doctor uses a local anesthetic. This means only the small area being treated is numbed, so you won't feel any pain during the procedure. You will be awake and can even chat with the medical team if you like. This avoids the risks and groggy feeling that can come with a general anesthetic. making the whole experience much easier. Let's talk about what you can expect during the appointment. The entire procedure is very quick, usually taking only about 15 to 20 minutes from start to finish. You will be asked to lie down comfortably on your side. After the local anesthetic is applied and has worked its magic, the doctor will begin the treatment. You might feel a slight sensation of warmth or a little bit of pressure, but you should not feel any sharp pain at all. Because it's so fast, it's often called a walk-in, walk-out procedure, meaning you can go home very soon after it's done. Recovery after the Rafaelo procedure is another huge plus point. With traditional surgery, recovery can take several weeks and can be quite painful. But with Rafaelo, most people feel much better very quickly. You might have some mild discomfort for a day or two afterwards, but this can usually be managed with simple painkillers like paracetamol. Most people are able to get back to their normal activities, including work, the very next day. This is a massive difference compared to the long and difficult recovery that often follows major surgery for hemorrhoids. Because the procedure is so minimally invasive, the risk of complications is also much lower. There are no cuts or stitches involved, which means there is less chance of infection and less pain after the treatment. You will be given some simple advice to follow, like eating plenty of fiber and drinking lots of water to keep your poo soft and avoid straining. Following this advice will help the area heal nicely and reduce the chance of any new hemorrhoids appearing in the future. The aim is to get you back to feeling comfortable and confident as quickly and safely as possible. The Rafaelo procedure is a fantastic treatment, but it is most effective for certain types of hemorrhoids. It is mainly designed to treat internal hemorrhoids. These are the ones graded from 1 to 3. Grade 1 hemorrhoids are small and stay inside. Grade 2 hemorrhoids may pop out when you go to the toilet but go back in by themselves. Grade 3 hemorrhoids pop out and you have to push them back in yourself. If you have these types of hemorrhoids and are experiencing symptoms like bleeding or discomfort, then Rafaelo could be an excellent choice for you to get quick and lasting relief. However, the procedure may not be the best option for everyone. It is generally not used for grade 4 hemorrhoids, which are the ones that have popped out and cannot be pushed back in. It is also not typically used for external hemorrhoids, those lumps you can feel on the outside. Your doctor will need to examine you properly to determine what grade and type of hemorrhoids you have. This is a very important step to make sure you are offered the treatment that will work best for your specific situation and give you the best possible result. So, who is a perfect candidate? A good candidate is someone who has tried simpler treatments like creams or changes to their diet but is still having problems with their internal hemorrhoids. It's for people who want to avoid the pain and long recovery time of traditional surgery. If you are looking for a quick and effective solution that lets you get back to your life with minimal disruption, then it is definitely worth asking your doctor about the Rafaelo procedure. It's a great middle ground option that is more effective than creams, but much less daunting than surgery. To sum it all up, the Rafaelo procedure offers some brilliant benefits. It provides fast and effective relief from the annoying symptoms of internal hemorrhoids. The treatment itself is very quick and is done using only a local anesthetic, so it is much more comfortable. There is very little pain afterwards, and the recovery is incredibly fast, allowing you to return to your normal routine almost immediately. By using clever technology to shrink the hemorrhoid without cuts or stitches, it gives a long-term solution with a lower risk of problems. If you think this might be for you, have a chat with your doctor to see if you can say goodbye to hemorrhoids for good.